A lot of people are not really clear on what natural health is and what you might learn in natural health education. What I have found in owning a natural product store, which I've had since 1998, the very first thing that happens is people come in and say, what should I take for? So they'll come in and they'll announce their ailment. Typically it might even be a medical diagnosis to which I do not respond. I have to ask questions because I'm not a medical doctor, I do not prescribe, I do not practice medicine. So they will come in and say, I have this condition, what do I take for it? One thing I'd like to clear up right up front, and a lot of natural health practitioners already know this, a lot of students of natural health already know this, and that is that we do not play doctor with herbs, we do not play doctor with supplements or vitamins or homeopathy or flower essences. Any of those modalities that you might find in natural health, we don't play doctor with those. More than anything I have noticed that natural health practitioners are very, very good in physiology. Physiology, I find, interestingly, is a science because I took physiology in school and I got a science credit for it. So I find it fascinating when I'm talking to people who let me know that my field of choice is not based in science, that they are not considering physiology to be a legitimate science. So I would encourage you as a natural health student, practitioner, educator, to let people know that we are indeed science-based. Do it kindly, honor their position, recognize that they don't necessarily know what we do and they would have no way of knowing what we know. But try to focus on the fact that we do actually go through a lot of education and that how the human body operates, the body systems concept, is one of the foundations of our practice and of our education. So one of the myths that I just wanted to dispel right off the top. Another thing that a lot of people aren't really clear about is that they believe, I believe, they believe that natural health practitioners are in opposition to allopathic or medical practitioners, and that we are trying to sway people from medicine, from traditional medicine. And the fact is that indeed that is not the case. We honor, as you've probably heard all of us say from time to time, we honor all education. And we understand our role as far as teaching people to help keep themselves healthy, as well as we understand the role of good medical practice. And we support both fully. So we are not going to try to spend our time talking you out of going to see your medical doctor. That will never happen. If you encounter a natural health practitioner who does that, I want you to turn right around and walk out the door, because that is not the person with whom you want to be practicing. That is a dangerous message that is being sent. It is important to understand that each practice has its place, and working together is extremely important. I am honored and thrilled to have the trust of several medical practitioners in my community who feel that it's very relevant and very helpful to refer their patients who then become my clients. But we do not talk about the same things, and I will never make medical decisions for anyone. So it's very important to understand that we can honor both positions, educate ourselves, and that everything has its place.